Hello, my name is Trevor Stratton. I work with communities, alliances, and networks. I've been living with HIV for 31 years. And as you know, the International AIDS Conference is coming to Montreal, Canada, on July 29th to August 2nd this year in 2022. And we're all going to go there. But I want to read you this article from the Canadian Medical Association Journal from 1989, July 15th, in fact. It's titled, After Montreal, International AIDS Conferences Will Never Be the Same. The size and complexity of the 5th International Conference on AIDS held in Montreal, June 4th to 9th, paralleled the dimensions of the disease itself. Conference organizers, the Canadian International Development Research Centre, IDRC, the Department of National Health and Welfare, the World Health Organization, and the International AIDS Society had expected 10,000 delegates. They had to shut down registration on the first full day, with attendance fast approaching 12,000. The overflow pushed facilities at the Palais de Congrès and the adjacent Guy Favreau complex past capacity and led to long waits for everything from information to currency exchange. Many sessions were filled well before the scheduling started times, forcing latecomers to search out closed-circuit monitors. More than once, the audio portion of those broadcasts failed to function, leading to frustration and anger among some delegates. In fact, those emotions were never far from the surface throughout this event. The tone was set at the opening ceremonies by Dr. Jonathan Mann, director of WHO's Global AIDS Program, who stated that the global outlook for AIDS in the coming decade will likely be bleaker than in the 1980s, perhaps much bleaker. By the year 2000, 6 million people will likely have full-blown AIDS. Most of them will be in the third world. Keynote speaker Kenneth Kaunda, president of Zambia, pressed home the same theme, calling AIDS a bomb with the potential to reverse the significant gains that medical science has achieved. He talked about his son's death from the disease and called for the world's nuclear powers to divert weapons spending into AIDS research. A more tangible and more vociferous anger was expressed by the New York City-based AIDS Coalition to Unleash Power, better known by its wholly appropriate acronym, ACT UP. About 200 of its members and their supporters commandeered the stage at the opening, postponing Prime Minister Brian Mulroney's address by an hour as they issued the so-called Montreal Manifesto, listing demands for PWAs, people with AIDS. Members of ACT UP also crashed a Monday afternoon press conference to pepper New York City Health Commissioner Stephen Joseph with questions about statements attributed to him by the New York Post. When his answers didn't satisfy them, they hissed and jeered. That press briefing symbolized how the conference became dominated by concerns about AIDS treatment in the United States, while ACT UP members and American journalists continued to seek clarification from Joseph about protecting the civil rights of carriers of the human immunodeficiency virus, HIV, in New York. Other panelists, including Health and Welfare Deputy Minister Maureen Law, Thai AIDS specialist Mechai Viravayada, and French geneticist Albert Jacquard, sat waiting for questions that never came. The Tuesday press conference was similarly dominated by questions to Jane Mason, the American Assistant Secretary of Health. Part of this domination was a natural result of the conference's physical proximity to the U.S. and the large number of American journalists among the 1,059 reporters in attendance. But it also demonstrated the difficulty of dealing with the rapidly changing face of AIDS in other parts of the world. Although North American journalists and their audiences have had almost a decade to come to grips with AIDS as a disease that is most prevalent among homosexual men, they are not well versed about additional problems: the spread of HIV among heterosexuals, gay women, and intravenous drug users, and from mother to fetus. Those topics and others were discussed at a total of almost 300 sessions that ran concurrently at 3 separate times each day of the conference. Each session was chaired by eminent researchers and featured several presentations of abstracts. The sessions were divided into 8 categories: epidemiology and public health, clinical aspects, basic research, biomedical, AIDS and the individual, AIDS, society and behavior, ethics and law, international issues, and the economic impact of AIDS. Those abstracts were not tabled in public sessions, were presented during daily poster sessions. In all, more than 3,500 papers were delivered. Seminar participants learned that stopping the spread of the virus throughout the rest of the world presents problems never before encountered. Members of various panels discussed the difficulties in introducing safe sex practices in societies where sex is a taboo subject, of offering needle exchange programs in U.S. ghettos where cultural leaders preach that it's a means for white racist governments to keep the Black and Hispanic communities on drugs, and how the Ugandan government considers it tantamount to genocide to advise HIV-positive women to refrain from bearing children. The secondary concerns relating to the global crisis in public health, the costs, are themselves overwhelming. If Jonathan Mann's prognosis for the spread of AIDS in the 1990s is chilly, the anticipation of the costs around the world is no less so. Simply put, the third world does not have enough money to purchase the types of AIDS treatments discussed at this conference. Seminars on the cost of treating AIDS in the developing countries revealed that economists are still establishing models to enable them to project costs into the next decade. Other sessions struck a more positive note. A particularly popular and informative one took the form of a roundtable discussion on epidemiology entitled Analysis of Public Health Policy for the Prevention of AIDS. Where have we gone wrong? Where do we go from here? Co-chaired by Dr. Donald Francis of the Centers for Disease Control in Atlanta and a Swiss health official, Bernito Somaini, the panel featured John Waters, who runs a needle exchange program for IV drug users in San Francisco, and Randy Schultz, the San Francisco Chronicle reporter who wrote The Band Played On, widely regarded as the definitive book about the spread of AIDS in North America. Francis spoke powerfully of the need to draw together the world family to combat AIDS and to cut through bureaucratic red tape and to provide treatment. Even ACT UP members applauded. Schultz provided a succinct history of how he believes the U.S. government has bungled the AIDS crisis, culminating in President Ronald Reagan's decision to designate last October AIDS Awareness Month, but his failure to sign the appropriate bill until October 28th, and his office's failure to announce the designation until well into November. Waters stressed the need for street-level programs that attack the problems at the source. What's the point of providing a needle exchange program, he asked, if you don't offer it in neighborhoods where drug users congregate? Somaini presented a visual tour of Switzerland's graphic AIDS education campaign, including a novel approach for marketing condoms that flies in the face of convention in his normally conservative homeland. This hard-hitting campaign is directed at the middle class and is a visual attempt to make the condom a sexy product, just like cologne and numerous other items. The visual attack on AIDS in other parts of the world was on display at CDART exhibitions at several locations in downtown Montreal. As expressions of cultural communication, the posters and print advertisements illustrated that Canadians and Americans have not mustered much imagination in putting the anti-AIDS message across. Opposite the main conference hall, videos were screened in the National Film Board Theatre at the Guy Favreau complex. One session on women and AIDS included videos that ranged from the outrageous self-sex slut by San Francisco prostitute Carol Leigh to the tragic story of Corey Sobel, a 4-year-old who was infected with HIV during a blood transfusion. Also featured was a provocative piece by ACT UP members, Doctors, Liars, and Women, which documented their fight against Cosmopolitan magazine, and a U.S. psychiatrist who wrote an article stating that heterosexual women were not threatened by AIDS. Inside the conference center, delegates wandered through display booths set up by more than 100 commercial exhibitors ranging from the city of San Francisco to major international pharmaceutical manufacturers. The conference produced a few newsmaking medical announcements. Topping the list was a presentation by Dr. Jonas Salk, co-founder of polio vaccine. He captured media attention by announcing that his institute's HIV vaccine tests involving chimpanzees have been successful. Although preliminary tests on humans have proven inconclusive, Salk was optimistic that a vaccine protecting against the virus is a possibility. Mason, the assistant health secretary in the U.S., expressed confidence that AIDS will eventually become a manageable disease like diabetes. Regardless of the outcome of current research, though, he predicted that the AIDS experience will substantially and permanently change how we test drugs. Perhaps the most encouraging medical signs were the number of small steps toward a control, if not an outright cure. Several papers detailed positive results from tests of the antiviral drug azithromycin, AZT, or zidovudine, sorry for my pronunciation, and pentamidine, which is used in aerosol form to prevent pneumocystis carinii pneumonia in AIDS patients. You might know it as PCP. Canada's Federal Centre for AIDS has had distressing news, though. It reported that 4 cases of HIV-2 infection have been diagnosed in the country. CMAJ reported the first 2 cases in its January 15th issue. This retrovirus is more difficult to detect than the more common HIV-1. No major policy announcements were made by Canadian officials. Neither the Prime Minister nor the Health Minister, Perrin Beatty, who spoke at the closing ceremony, committed Canada to any specific AIDS programs. Beatty, whose sources say is in favor of stepping up the fight against AIDS, said that governments must care and called for a national strategy on AIDS, although no funding is likely to be forthcoming immediately. The government's failure to put forward anything concrete resulted in some tough shots from a number of outspoken critics. Speaking at the first day's plenary session, broadcaster David Suzuki said, "As a scientist, I am ashamed of the Canadian government's lack of a serious, coherent response to AIDS. But the Canadians did succeed in their role as hosts. Faced with massive overcrowding and protesters who had been schooled on the streets of Manhattan, IDRC President Ivan Head and his staff never lost control. The organizers achieved their goal of ensuring that scientists, physicians, and journalists from developing countries were an integral part of the Congress, although it remained in the hands of ACT UP and their Canadian supporters to shift the spotlight to those infected with HIV. Then the 1990 conference is set for next June 20 to 24 in San Francisco, where it's estimated that as many as 1 in 5 residents is HIV positive. AIDS activists are demanding that the political ramifications of the disease be included in the program there. Conference organizers at the University of California, San Francisco, will have to strike a balance between the activists and the scientists who criticize the amount of social content in the Montreal program. One thing is definite. After Montreal, the International Conference on AIDS will never be the same. The demonstrations and the Montreal Manifesto will have the same effect on the complexion of future conferences that the raised fists of radical black U.S. sprinters Tommy Smith and John Carlos had on Olympic Games held after 1968. Any event that draws sustained international media attention inevitably becomes a political forum. The Olympics have not been just a sports event since Mexico City, and the AIDS conference will never again be confined to medicine. Thank you.